Greetings, I am Dr. Sharjeel Sheikh. I'm specialist ENT surgeon at Emirates Specialty Hospital at Healthcare City, Dubai. Today I would like to discuss on the topic of snoring and sleep apnea. It's a very common ailment, but it goes undiagnosed and people do not pay heed or pay importance to what's happening. Snoring. Let's define snoring. Snoring is the sound that is produced by the posterior part of the oral cavity, and it happens mostly in deep sleep. It's not only just the act of mouth breathing, but the ailment and the repercussions it has on the body. It has various grades to it. Now, the common misconception is that if you are snoring, you are in deep sleep, you are sleeping well, but sadly it's the other way around. Generally, people in the deepest part of their sleep, when they lose the muscle tonicity, then the snoring, the sound happens. But as it progresses later on in life, the duration of the snoring, it increases and the severity increases, which in turn later translates to as sleep apnea. How and what are the presentation, the symptoms? Mostly patients feel that there is a lethargy, they feel tired throughout the day, though they might sleep for a good 8 to 10 hours, but they don't feel the freshness the next day, in the morning and throughout the day as well. They have certain tendencies of craving in terms of food, the type of food that they consume. There can be sudden weight gain, and eventually it translates to more fatigue, tiredness and irritability, and it hampers your personal as well as professional life. Now coming down to the ailment. Now if it is not diagnosed, if it goes undiagnosed and it becomes chronic, it eventually leads to sleep apnea. Now sleep apnea is the obstruction or cessation of breathing. There's a stoppage of breathing for a couple of seconds, and it causes you to either wake up from sleep or you have a disturbed sleep. Now this, if it becomes repetitive, so eventually the patient does not have a good, fulfilling and sound sleep. So though you might sleep for a good 8 to 10 hours, but the purpose of sleep is not served. And the sleep apnea, again, I mean, if the duration increases and if you have some underlying diseases like diabetes and blood pressure or familial tendency, then these flare up, these come up early. So the quality of life gets hampered by all these ailments together. Coming to the diagnosis part, now how do we need to diagnose? We have to look at the point of obstruction. If it's just a nasal obstruction, it can happen because of allergies, obstruction due to deviated nasal septum or DNS, as a lot of common person might be knowing it. It can be because of polyps, both allergic and some tissue growth as well, like adenoids. And if it is lower down, an obstruction in the oral cavity, oropharynx, it can be because of some tonsillar tissue, some hypertrophy of the tongue. So eventually we have to look at the point as to where the obstruction is happening, why is it happening, and need to address it accordingly. For investigative purposes, we have in-house out here in the hospital itself the digital X-ray. If needed, then we might proceed with the endoscopy, the nasal endoscopy, and take a call about the CT scan if it's needed and how it can be beneficial to the patient. Again, the obstruction, where it lies and the ailment it causes with it, so we have to address that. There are two parts to it. One is the medical aspect, wherein we try and treat the allergies with of course tablet forms, with nasal sprays, and see how much of improvement it causes in the patient. And lastly, coming to the surgical part, depending on the obstruction, if it is a deviated septum, if there is some polypoidal growth, some tissue growth with turbinates, we need to address that as well. So going with both the medical and the surgical aspect individually or combined, we provide the best possible treatment for the patient. We have all the modalities in terms of the nasal endoscopy. The best surgical equipments and the procedures can be performed out here for the best benefit for the patient. Other than this, we also provide all the general ENT ailments, the treatment for that, and depending on the ailment, the best possible treatment. Thank you.